So welcome to this press conference concerning COVID-19. My name is Serological, and the conference will take place as follows. The Minister of Health and Public Services, Mr. Christian Dube, will first speak to you, and then there will be a question period in which the National Director of Public Health of Quebec, Dr. Horacio Arruda, will also be available to answer questions. Without any further ado, I'm very happy to hand over the mic to Mr. Dube. So, thank you very much, and a good day to everyone. Hello, Dr. Arruda. Very happy to see you once again, back from your vacation. Thank you for being here with us today. And at the same time, speaking of vacation, I wish a good return to many Quebecers who had the opportunity of being on holiday in the course of the past week, so to come back to work. I would like to thank Quebecers in general for the solidarity that was shown over the past few weeks. You remember that we made many calls for collective effort on various points, one of them for screening. But I would say a lot having to do with wearing the mask, and I'd like to come back to that a little bit later on because these calls really were heard by the public in general, and I wish to clarify that. I'd like to start with screening. Specifically, screening, and it is recognized, is one of the most powerful weapons that we have to fight against the virus. I'll be saying it often, and I'll be getting back to this. This is what makes us think that in the second wave, we could be a lot more proactive rather than reactive, as we were in the first wave for obvious reasons, or as we had to be. The number of samples that we had in the past few days and weeks has surpassed many times 17,000, which was not even an objective that we had a few weeks ago. So in fact, for the day, for those who like numbers like I do, for the day of the 31st of July, we had 18,437 samples taken. So we're very happy about this. It's not an objective as such to only be testing, but we want to be able to test properly. And we wish to have the results quickly, and we're working on that because there's still improvements to be brought. And I would like to say that it's very encouraging, but we're not going to stop there because we have to be able to have proactive screening. I want to reiterate that. I would also like to speak, earlier I said that there might be elements where we've asked for collective effort. For those coming back from holiday, yes, we have to go back to work. But we were able to see during the holiday period, sometimes, people are not as attentive. There might have been cases where, through inadvertence, we might have contracted the virus, although, as we can see, people are making efforts. And I would ask the public in general, those coming back from holidays or those who, unfortunately, were not able to go, I really wish to insist on voluntary screening. We are equipped to do so, as I've said, but if you have a doubt whatsoever, whether it be through involuntary means, as I said, or perhaps there was a little party somewhere and you thought that you were limited to 10 people and then it wasn't done for whatever reason, well, do not hesitate to go get tested because you'll recall our statistics last week where there was an upsurge in young people and what we call the zone of which Ms. Guilbeault spoke of very clearly last week, teenagers and young adults. The virus is still very present in these people, and we can't let down our guard. So at the least sign, I really wish to emphasize that today. If you have a risky situation, whether it was involuntary or not, it's really important to go get tested because as we can see from our daily statistics, the virus is still there and it remains contagious. I would like to remind you, however, that it was expected as well as normal because we really have to see that in the course of the past weeks, we went from confinement that was almost entire to total deconfinement. People went on holiday. So that there will be contagion is normal. We knew it, and we'll be able to talk about it with Dr. Arruda. But at the same time, if you or your children, because I think that in the case of daycare centers that are open, we saw that there were some cases, for example, in day camps. I'd like to repeat it. There might be some of those cases. We saw it. So I would ask the parents to be very vigilant. And at the least sign, don't hesitate to go get tested, yourself and your children. I said right off the bat today that there was collective effort about screening. And once again, I wish to thank you. Now, about wearing masks, and particularly in closed areas. Quebecers, I think that we can see it. I see it here with the people who each have their mask. But we see it on the street, we see it in restaurants, we see it in bars, we see it everywhere. Quebecers are really there. And we saw the percentages increase in the past few weeks. Ms. Guilbeault said so. I think that her expression was very heard. It really is a habit. It's a social norm now, a standard. And what I like as an expression is that we are there to give an example. The better example we give, that it is now normal to be wearing a mask, I think that everybody will be able to understand that it's not only to respect ourselves personally, but to respect others as well. So I would like to make a reminder today on inside places. I said it earlier on. It's quite clear. Private places, private parties, as we call them, private gatherings, whether they be in a backyard or in a home or personal residence, they have to be limited to 10 people. There is no change that we are ready to bring to that. It is too important for the reasons that we have explained at length. I would like also to say that we are going to have to make sure that inside gatherings that we want to now bring from 50 to 250 people be able to be done, but within very strict standards. We're not talking here about gatherings. We really are talking about auditoriums. We're talking about public. We're talking about, I'll give you the simplest example. We are here at La Place des Arts for this press conference. We can go up to 250 people, but not in this room. We really would need a room that can allow 250 people while maintaining the social distancing that we are requiring. So I would like to say, in conclusion, after having talked about screening and wearing masks, I would like for us to give ourselves a challenge. The challenge, for me, is a significant one. We know that a few weeks ago, people were worried about the increase in the number of daily cases. We had gone up, as you recall, to 180 cases per day. And it's normal that this concerns us. It's on our radar. The good news is that in the past few days, we can see that there was a certain stability. However, every time we add, even a good day like yesterday, where there were 120-some cases, and we add those cases to what we call our active cases. And my concern, our concern, to the entire team's concern is that when we go into the second wave, we would like for that number of active cases to be as low as possible, because every time we add cases to it, it might be somebody who will end up in hospital, somebody who will be in intensive care. And behind those numbers, even for somebody like me who likes numbers, this is somebody who is ill, somebody from your family, somebody who is, and as we saw more and more, children. So to summarize, I would like to say that I would like for us to give ourselves a collective challenge to lower down that number of cases as quickly as possible. We've seen it in the past few days and weeks that when Quebecers get together for a collective effort, we succeed very well, and we succeed doing it proactively and voluntarily. So I would like to say that if I have one wish, with the public health team and the entire team from the ministry is to be able to lower that number of cases that we have every day, as we did in the past few days. And that is an effort that can be made by each and every one of you to give the example, to wear the mask, to keep social distancing, to wash your hands, and if you have the slightest doubt, go get screened. English?
As I said, the great majority of Quebecers took the last 2 weeks off to rest and explore our beautiful Quebec and spend some quality time or family time. That's all to the good and well-deserved by all. But allow me to remind workers that are back from vacation that they should not hesitate to be tested. If you know that distancing measures were not followed during your vacation, unfortunately, you are at risk. Today, I want to renew my call for vigilance, this time on the part of parents whose children attend day camps and daycare centers. While we have noted the numbers of outbreaks in these environments over the last few weeks, I must stress, however, that the situation is under control. We can really see that the habits have changed and that in order to protect themselves and others, people are wearing masks. Now then, we have closely monitored the situation and do not deem necessary to issue fines to those who not complied with health directive. But I say, at least not for the moment. Let me stress the word for the moment because we do not exclude the possibility in the future. Finally, I would like to remind you and everybody that the maximum number of people authorized for indoor location, as I said, at any one time has risen from 50 to 250. But this limit applies to meeting venues, as we say, in cinemas, performance hall, and places of worship, what we referred, as I said in French, referring to auditorium, not assembly location. And finally, with respect to other public settings, the rules are expected to be available after our cabinet on Wednesday. Let's remain vigilant. I think, as I said, we can improve, and I would like, in conclusion, to reduce the number of daily cases that we can see in the next few weeks to make sure that we are ready to start the second wave with a lower number. This is a collective effort, and I want to thank all Quebecers for all the effort that have been done, and that we will win this battle together. Thank you. Thank you.
Merci. Alors, nous allons maintenant...
Thank you. We'll now be going to the question period, starting in French.
Nous avons plusieurs médias dans la salle aujourd'hui. On va privilégier une question par personne et après, on verra si le temps nous le permet de poser une seconde question. Alors, s'il vous plaît, précisez votre nom et votre média, micro 1.
Ariane Lacourcière de la presse. Depuis une semaine, les chiffres...
For the past week, the numbers have not always been available. I don't know if you're reviewing the system. But do you have any details? We're talking about 123 cases today. Is it young people, older people? The deaths, are they CHSLD-related deaths? Do you want to answer, and then I'll complete? Yes, because we are implementing a new system which will allow us to better integrate the investigation of case and contacts. We've had certain charts are not available right now because the systems are being remodulated, but we're still following the situation. There is nothing right now in the information that is missing for us to be able to make decisions. The outbreaks that we have right now are mainly associated, I would say, to situations that are either, day camp or where one or two camp counselors were ill and then infections were created. So people don't just, their job. They also have meetings, parties, etc. So it's really outbreaks in those kinds of universe. There's a few outbreaks that have been associated to foreign workers that were made. There are more screenings that were done right now, and the deaths are right now still older people who have died. Even in the death that we have right now, one of the two deaths that we had today comes from It was a recompilation of data, so one comes from a few weeks ago. But what I want to say about the epidemiological portrait right now in the situation, as the minister said, the situation is under control right now. We're not going up progressively. However, things remain fragile. And the other element that I'd like to draw your attention on, we focused a lot on bars as being places of transmission, but we noticed that it's really associated to gatherings of larger numbers of people that are not in an outside context. They're in the family, for example, around certain campgrounds, there must have been, and now I invite Quebecers who went, on holiday to get tested, but those who were in regions where there was no circulation to get tested as well, because maybe they were asymptomatic people there. But if you end up in a situation where it's not natural to be 2 meters away. You end up a bunch of guys and gals together in a private party. There's 15 of you instead of 10 or 12. And in that situation, there's just one that's to generate a case without knowing, etc. And the other element that I want to insist on, we have to collaborate with public health. If you are told you were in contact with a case and we ask you to isolate yourself, don't, because we had questions of people who were being investigated or even people with symptoms who went to other parties. They weren't really ill and they thought it wasn't a big deal, but that generates more and more cases. And that is where we'll end up with 150, 160, 180, 200 cases. So I really wish to emphasize that. And it's not a sin to have had, to have gone closer to somebody at one point. But if you get screened early, if you follow the guidelines, you won't generate, and it won't be your grandmother or people at risk who will get ill. And maybe to just come back to your question, as far as the data is concerned and the computer systems, because there were a few articles written on that, and I think that it's normal that people ask questions. I would like to summarize it to you, and I can talk about it again because I'm putting a lot of pressure to be able to have these systems regularized over the next few days. But it's a question of weeks. Last week, we were able to give statistics. As you'll recall, we made charts regionally per age group and type of activity. I wish for those charts to start being there again as quickly as possible. And I'm told that the two systems, because there was one system that was on the side of the INSPQ and another on public health side, which sometimes had certain differences. People have to understand that the main reason why we are making these adjustments is for there to be just the one system so that we can go do data research in order to be able to make analyses as quickly as possible. I would have liked for the transition to be made, really quickly. It's a little longer than planned, but it's the right moment to do it because things have calmed down right now. So I would like to reassure you that the things that are missing, the information is missing, is not a lack of transparency. Dr. Arruda and his team know I put a lot of pressure on them, but I've been told that by the end of the week it should be fixed. So we will probably have been about a week or 10 days, if I include both weekends, without that data. But I can tell you that there is no missing data. We have all the data that we need to be able to make well-informed decisions. But I understand that people want to question themselves, particularly in journalists. I respect that. I am the first to put pressure so that both of these systems be adjusted over the next few days. I just want to make sure that I've understood correctly, Dr. Arruda. You said that perhaps it's not as much in bars and more in private gatherings where there's outbreaks, and you said that I invite everybody who went on holiday to get tested. So the people who went in campgrounds who were able to, unfortunately, perhaps be 15 rather than 12, it really is, you're making a call out to those people. Yes, and particularly if you think that you have a symptom that doesn't look all that bad, that looks like it's a small cold or something, please do it quickly.
Monsieur le Ministre, vous avez...
Mr. Minister, you've often announced that you wanted to increase the test. Now it's been done. And now there's the delays. You talked about it a little earlier on, people who end up waiting at home for 5 days without being able to go to work, and to that is being aid. The lab technicians are getting exhausted. They've been sounding the alarm now for a few hours and days. There are things that are being done elsewhere, like quicker tests in pharmacies. It's a case in France, for example. With the decentralization of analyses, is that something that is possible here, or is that not at all on your radar screen? I will let Dr. Arruda answer, but I would like to talk about it as well. As far as decentralization is done, it's done. Is concerned, it's done, but not for private clinics and pharmacies. It started by the Public Health Lab of Quebec, who made tests and who validated and brought it elsewhere. The problem with quick tests that are done commercially is the quality of the test. Right now, we have a testing standard because we don't want to have too many false positives or false negatives. And we know that these commercial tests, even though they can be useful in certain contexts, are not as good as what our expectations are in Quebec. We would have loved to have had that, I'll tell you honestly, tests that we could have done that way. The element is that these tests don't allow us to have a lot of volumetry. So we are doing analysis, but you're right here, and I think that the minister is going to tell us, like the computer systems as well, people who are positive have to be contacted quickly, but people who are negative, it can take longer. But it's not acceptable because those people are stopped during those numbers of days, and there's the acquired question of human resources. And that's a bit of a chronic and systemic problem in our system right now. There can be a lack of human resources, but it's something that we are working on, and it's part of the indicators that we are going to be following regularly on how long it takes for a test to be analyzed. It's pretty, that part is really quick, but until the test gets to the person, that's where the delay takes place. And I would like to complete, if you'll allow me, because I said that it's really nice to increase the number of tests, but we have to be efficient. We have to give service, better service in terms of response. In fact, I think that the main point is for those who often have a negative test, it's just as important for them to know that as somebody who's positive. So now what we're looking at is the test is done. We have the answer, but we haven't contacted the people. So now what I've done is I've asked the people, and we've added. I told you that we're reinforcing the team, our entire team of deputy ministers. We have people from logistics right now that are looking from the beginning to the end. You'll remember when we had the Montreal report last week, the question of screening was problematic because we didn't know, or rather it wasn't clear, what was public health in the planning, in the objectives. But we were saying that we were letting the CIS and CIUS, the operation of the test and the handling of it. So there were perhaps places where things were not very clear. So the day that the test is done, the logistics is who calls who and how to support them. So yes, maybe there are issues, and I won't keep it from you. As far as the regroupment that is ongoing of certain labs, it's not finished. There's been an effort on that. But I would say that globally, we are working on the logistics aspect of it, and I think that the benefit, people will be able to see it. The results are going to be communicated to people more quickly.
Pardon?
J'ai pas une question de suivi.
Non, c'est une question par journaliste, s'il vous plaît. On va passer au prochain. Merci.
Alors, bonjour, Monsieur Arruda, Monsieur Dube, Marie-Josée Paquette-Comeau de Radio-Canada.
Bonjour.
À la suite, alors, en Ontario...
In Ontario, following a serological investigation, public health has declared that there were 4 times more cases of coronavirus in the public as those detected by public health. Where is Quebec in terms of these serological tests, and are we going to be able to have that kind of data? You talked about reducing the number of active cases. Yes, there's a study done by EMA Quebec that is done, and the results are going to be made public shortly. That will allow us to estimate the proportion of people who were infected in the public. The Ontario numbers are about 1.something to 3%, and we expect about the same level here in Quebec. In the metropolitan area, it'll probably be much higher than in peripheral regions. And the preliminary results that I was sent were going towards that. They haven't been made public yet. And we'll be able to make the comparison to our data in terms of screening our cases compared to what was done in serological studies. It's very clear that in any epidemic, there are more people who are infected and that we detect through serology rather than screening, because those people never had any symptoms, so they never went to consult. So with the blood that was given will have a serological study. So it's going to be very soon, in a few days probably. This is a delicate question, but I think it must be posed. Mr. Arruda, you launched a formal complaint to the police officer following the broadcasting of your personal address on social media. I understand that you're very limited in the comments that you can make, but could we have a reaction so that people really understand that the impact that that can have, broadcasting that kind of information on the public front? Are you comfortable answering? I can answer. You'll understand that I have a professional life and I have a private life with a family. When people, and I don't think it's of any public interest that people know exactly where I live, the address or anything like that. I don't see what that can offer to the public. So in that context, and also in the context of other comments that were made about me, for the safety of my family, you will understand that I cannot necessarily accept that this is done, because this brings about anxiety. And even though 98.5 or 99% of the public will not use it wrongly, there can be people that could bring about unfortunate things. That I'm attacked is one thing, but that my family get attacked, I have the reflex of being the Lion King who wants to protect his family. So it's in that sense. Yeah, it was just for people to understand the importance. Thank you for having done that correctly. Thank you. Mr. Dube, you were talking about the number of active cases that has to be respected over the summer. If I'm not mistaken, the latest numbers were around 2,000 active cases in Quebec. Please correct me if I'm wrong. Is there a ceiling that should not be reached over the next few weeks and months for you? I was convinced you were going to be asking me the question. I prefer not giving a specific number. But what we do want, I can tell you, is that we want it to be as low as possible. Look at Ontario yesterday. They were at about 120 some cases. I think that we can do better because, once again, and I'll keep it very simple, we have a very great part of the public that is being careful and who is following the guidelines. And despite that, there are involuntary things that are done that create cases. So what I tell myself is that in those involuntary things, it's difficult to do better than what we're doing now. What concerns me are those who don't follow the guidelines and who are conscious of it and who like to defy things. And it's on those people that we have to work right now. And I think that the example that the population is giving to those people is going to make it that there's a lot of leeway to decrease the number of cases. And we've seen it. And if we give ourselves this as an objective, the example of wearing a mask, to say that this is the new standard, like what Ms. Guilbeault was telling us, I prefer letting ourselves be surprised by people and that we see one another next week again and say, listen, we've seen the impact of what a good example can bring about. Can we beat Ontario? I would like for us to not just be economically, but in terms of public health, I would like for us to have really good statistics. I am under the impression that we're heading that way. And we did in a time of major deconfinement with, construction holidays. Now I'm asking people to go get screened because it's the right time to do it for the reasons that we explained. I'm going to let people surprise us with good news over the next few weeks.
Bonjour à vous deux. Je trouve ma question une petite seconde. Donc, des diffuseurs de spectacles à qui le...
So, show broadcasters with whom newspapers talked this morning are want to reduce to 1 meter the distance between people in auditoriums rather than 1 meter in 0.5, and to increase a limit that would allow them to have larger shows and a more numerous public. So this for the performing arts. Are these things that are being thought of in the near future? Since the very beginning, if you allow me, go ahead. Since the very beginning of the pandemic, we've gone progressively because I think that it is important as I was saying, to learn to, crawl before we learn to walk, etc. Right now, we're going from 50 to 250. The 1.5 meters has already, compared to 2 meters, it already is, a slackening. 1 meter is for young people who don't have much disease or symptom. But in, a room, already at 1.5, we're already below the 2 meters. So in the short term, let's go with what we have as such. Let's see the effects that it can represent. Are we going to have outbreaks that is going to be associated to performances? I trust that if people respect the guidelines of wearing a mask when they move around, that the promoters have that performance respecting the guidelines. If we can show that there is no outbreak, we'll be able to slacken even more. That's what we did with bars as well. There were issues. We had specific interventions. We seemed to have control of everything. We didn't close down the bars. We left them open so we can live with adjustments. And right now, I think that the short-term answer is we've already made an important step from 50 to 250. Let's try 250 before going to more. And the 1.5 meter right now is already a compromise. I would like to know, with the back-to-school that is coming very quickly, is there a protocol that is already planned upon if ever a child tests positive? Is there a protocol? Is there massive screening that is going to be done? And also, how do you explain the coherence between the fact that children 12 and over will wear a mask but not inside a school, which is a closed public space? Well, protocols, yes, there are right now, yes. There are perhaps people who are saying that there aren't any because they weren't informed, but the Ministry of Education is working very closely with us. The question of wearing masks in high school is going to be reevaluated, but it has to be understood that controlled context in classrooms, etc., are very different from a context such as when you go to a supermarket, etc. There's a professor who can manage certain elements of physical distancing. That element will be specifically reviewed because the introduction of the mask in the community generates a whole series of questions. Can I have a face covering at work if I was wearing a procedural mask before? All those elements will be communicated clearly to the different actors. And if you'll allow me, with the time that I have to tell people, it's really important to not forget that it's social distancing. And I know I'm rambling on. Washing your hands, because I can tell you that since we added the mask, there's a lot fewer people washing their hands. There's fewer sites to wash your hands. So do not replace hand washing with the mask. The mask is very important. I'm not saying not to wear it. You have to wear it. But don't forget washing your hands. And the other thing, imagine that you have been perhaps inadvertently or even, openly delinquent and you have symptoms or you think that perhaps you've been infected. Get screened. Nobody from public health is going to come and accuse you or is going to mistreat you. It's a responsible gesture to say I was perhaps in a situation where I did not respect or where, people were a little too close as such. And I'll just go get the testing done. And if ever that's what it is, well, it's a gesture of citizenship and that you're doing. I would like to add something to the school question. There's a lot of questions right now, and it's not just part of a health plan, but a government plan, and people expect that. So we've had a lot of conversations with our colleague, Jean-François Roberge, in the past few days, and of course, the plan that was filed in June, and Mr. Roberge recognizes it, needs to be changed because between June and today, all sorts of things have been learned. We can see what is going on in other parts of the world. So what I understand today, and I can tell you, is that that plan, which is quite normal, and that is what was planned, will be next week. It will be updated. So I would like to reassure parents, after the plan that was created as quickly as possible in June, taking into account the new information that we have, and we'll see for your specific question, to make sure that there is no lack of coherence, because your question is very pertinent about that. And next week, we'll be able to talk about it. And I would also say that, with Ms. McCann and higher learning, and I add Mathieu Lacombe as well, because we have the daycare centres as well. So our government has a general plan, and this update is going to be done next week.
Je vous rappelle de nommer votre nom et votre média, s'il vous plaît.
Bonjour, si je peux en anglais, s'il vous plaît. René Brumer.
English?
Bonjour. As we're moving towards 250 gatherings of 250 people today, many people have questioned, especially given that we're going back to school fairly soon, why did Quebec decide to take this risk and move from 50 to 250? Some people feel that it was an unnecessary risk at this point.
Yes, first of all, I must say that the 50 to 250 is in the control area. We have not noticed any outbreaks related to the 50. If we had some, we would have probably questioned the situation. But we really think that in a space enough large to have 250 persons who are going to go to a show, sitting in a chair, separated by 1.5 meters, I think that the risk there is very acceptable comparing to, I would say, a party of 30 persons in a garden inside. The type of interaction between the people will be completely different. You don't kiss or even hug others when you go to I'm not talking about a rock show upstairs, which is not the same case. I'm talking in the Place des Arts. You're going to an opera. That's a well-ventilated place. People will have their masks when they're going to sit down. They can take off their masks. If they are at high risk of disease, they are elderly people, they can keep their mask. This is a situation which is completely different from, I would say, even what I think is a bigger risk, a party of young or even adults around the camping where there was not distanciation made.
Good afternoon, Amanda Klein with CTV. Just to sort of follow up on that, there was a petition over the weekend signed by a number of doctors who are saying that 250 is too large. Can you explain, is the logic behind it because the cases are stable right now? Is there an element of herd immunity in this? Is that the goal, or can you just explain what the idea is?
In fact, that's not a herd immunity. It's not because the numbers, it's clear if we're going to go up this way, we will not do that. It's just because when we look at the epidemiology, when we look at the experiences elsewhere, and also in Quebec, those kinds of gathering of 50 persons inside of a big space, like here, I don't think we had outbreaks related to the press conferences we're doing here, even we are inside. So if there is a big cell, like Place des Arts, Opera, and you can keep 250 persons, which is very low compared to what is to be, and there is distancing, that's a context where the transmission will not go. Because if you keep the 2 meters distanciation, if you wash your hands, because they will disinfecting the places too, and if you have the mask, and you're not singing, the singers are very far away, I can tell you, they are very far away. This is a non-risk comparing, I would say, to parties or gatherings in gardens or in the downstairs, where there's going to be no distancing, because we don't hug much people when we are in opera.
Merci.
Merci. Prochaine question.
Good afternoon, Gloria Enriquez with Global News. The Verdun Hospital is building a wing, as well as the Lakeshore Hospital. And so is this part of your preparations for the second wave? And what other preparations are there underway?
That's very interesting. This is, I'll take that one on. We have, I'll summarize it because we have some explanation to do over the next few weeks as part of the global plan for the second wave. But since you're asking about these two, in one of the issues that we have in the first wave, we had patients in hospital that were in double room or triple room. which was a big issue, if you recall. So what we need to do very quickly is to make sure that we, and it's not a pun, it's not a play on words, but that we make room for rooms that are not double or triple room. And in Verdun, which is a very old hospital, that's a good example of the issue that we're trying to solve very quickly with this modular hospital, because the hospital will be renovated, but that will take a couple of years. So what do we need to do in the meantime is we need to have access to modular facilities that takes months to build as opposed to years for the full infrastructure. And one of the things that we'll solve, one of the things will be that we'll have single room, which will be a key element in the second wave, right? That's the issue in Verdun, and I'll be tomorrow at Lakeshore because we want to see this example of what is being built right now as to how can we do it more quickly, because a modular facility has one big advantage is to being built faster, and our people at the Minister on Infrastructure are looking at all the hospitals that can be accommodated with this sort of facility. So thank you for your question, but we are working on that as part of solution for the second wave.
Les médias en français demandent cette réponse aussi en français, si vous pouvez...
Je vais essayer de traduire.
I will try to translate my answer. On the question of the two announcements that were made, one was made this morning by the Verdun Hospital, which is very important, on the construction, the modular construction of about 30 rooms. If I recall correctly, it's 36 rooms, and that is part of our plan for the second wave, in the sense that one of the elements that everybody recognizes quite well right now is that there were a lot of infections, either in CHSLDs or in establishments and hospitals, of people who were in double or triple rooms. And one of the things that we're working on very quickly right now is to have modular units, as we call them, that will allow us to have, amongst others, replacement rooms that will be simple rooms, single rooms, so that it will allow us to, when we have to move people, when we're waiting for a result or something, that we have access to these single rooms. The second advantage, as you know, is that we have hospital establishments that are very old. That of Verdun is a good example of it because it's from 1930 or something. We're talking about nearly 100 years. And we had accepted in Verdun to rebuild and renovate the hospital, but those are projects that last 2 to 3 years, and we cannot wait 2 to 3 years to have solutions, particularly for the pandemic or questions of emergencies. So we have a policy right now, and that is why tomorrow we're going to go to Lakeshore, and we're going to be doing exactly the same thing in the West Island, to be able to find solutions, temporary ones, that will allow us to distance people as much as possible, the double and triple rooms, and to have solutions while we renovate our hospitals. I think that summarizes the question. Thank you.
I think we can.
Dr. Arruda, I believe it was back in May that we were speaking about collecting data on the racial backgrounds of the victims or people who got it. I was wondering, where have we started that, and where are we on this project, and when will we fund it?
Committee, and I would say legal issues based on potential discrimination. So I think it's not, I would say, collected case by case, actually, but we are having other strategies to perhaps identify, I would say, what are the risk factors of certain communities. So we're going to have it in a type of approach that will be different from a case-to-case declaration of the racial perspective.
Can you explain that a bit?
It's because, it's sensitive data, and some groups would explain that we are discriminating based on racial processes and everything. So collecting exactly this name with this race and this situation could be, I would say, not necessarily based for a public health perspective. There is always a balance of what is personal life related to that. So with discussions with our public health people and our ethics committee, and given getting some information with the lawyers, we decided to have another approach will be more populational to identify certain sectors of risk factors.
When you say populational, you mean geographical?
Geographically, or I would say based on, yes, geographically, not related specifically to race, unless we have a hypothesis of, I would say, a genetic process. We could do that through, I would say, a specific study, but not in the data collected day by day.
On va y aller avec une dernière question, s'il vous plaît.
One last question, please.
Non, c'est vrai, vous avez raison.
I still recognize you, although you changed the microphone. Well, yes, I was told it was already disinfected. Mr. Dube, an update about wearing masks and fines. We were here on the 13th of July, I think, and you had said at that time, well, fines are going to go to business owners. But Mr. Legault had said that, we might change our minds and give fines to individual people. Is that being thought of? I'll answer quite quickly. It's not something that we've decided not to do, but we've decided not to do it right now. We made the decision, and you'll recognize the philosophical decision of our government that when we see the positive reaction from the very vast majority of people to mask wearing and respecting the guidelines, we prefer using an approach that is on a voluntary basis. Perhaps I wasn't clear earlier on, but that is the approach that we're taking right now. We're still talking about measures every Wednesday at the Ministers' Council, and if ever there is a need to do so, we will do so. But for the time being, I said it at the beginning, we truly appreciate people's reaction enormously. And for the time being, we do not judge that it is appropriate to do so. This puts an end to today's press conference. Thank you very much.